The reason we're here today is because Memorial Neuroscience Institute is very proud to receive, for now the 12th year in a row, the American Stroke Association, American Heart Association, Get With the Guidelines Stroke Gold Plus Achievement Award, with now the additional designation of a Target Stroke Elite Plus hospital. What this designation means, specifically the Elite Plus designation, which is the highest level of achievement possible for a stroke center, is that we can evaluate and administer the treatments that a stroke patient may be eligible for, specifically IV-TPA, as quickly as possible while not compromising the safety of the patient. So for the community, it's very important that we, as the forbearing hospital in the region, manage our patients as quickly as possible and provide the treatments in a time-sensitive fashion, because in a stroke, every second, every minute counts. Every minute that elapses, about 2 million neurons are at risk for irreversible injury. And so for our community, it's paramount that they seek out the hospitals that can provide these timely treatments in a rapid manner, so that they can get the best outcome possible. Not all stroke centers are the same, and we're very proud in this area to be the best hospital for management of stroke patients. And for that, the outcomes of the patients that we've demonstrated over a number of years speak for themselves. So our team is multidisciplinary, and that's what makes managing a stroke sometimes a very complex and in some hospitals a convoluted process. At Memorial, specifically at Memorial Regional and Memorial West, our two comprehensive stroke centers, we've streamlined the process as much as possible to optimize the efficiency along each step of the way. And so we have our ER team as soon as the patient arrives to the hospital to evaluate and stabilize the patient. Then our multidisciplinary radiology teams, as well as our neurology teams, to ensure that there's a timely diagnosis of the stroke patient. Stroke patient on arrival could have a multitude of diagnoses as to why they may be having their symptoms. For example, speech problems, arm, leg weakness could be due to a bleed in the brain, it could be due to a seizure, it could be due to a complex migraine. And so essentially to hone down to the fact that this could be a ischemic problem, meaning deprivation of oxygen in the brain, we have to have rapid evaluation by our skilled neurologists, as well as advanced imaging performed by our radiologists to identify a stroke quickly so that they can get the essential treatments while they're in the CT scanner. In order to achieve the Elite Plus recognition, the criteria are administering TPA in less than 60 minutes for greater than 75% of the time among patients eligible for IV-TPA. And additionally, the stricter criteria, which is what makes this cream of the crop, is giving the medication in less than 45 minutes from time of arrival to the ER in more than 50% of patients. So the current statistics at Memorial Regional are we give IV-TPA in less than 60 minutes in more than 75% of the patients. I would say right now we're at 77% of the patients. And in less than 45 minutes in 53% of patients. And we've done that consistently for the past year, and that's what made us eligible for the Target Stroke Elite Plus Award.